Welcome, everyone. This is your COVID Questions Answered with Dr. Teresa Tam and Dr. Howard New from the Public Health Agency of Canada, Dr. Evan Adams from the First Nations and Inuit Health Branch at Indigenous Services Canada, and Dr. Supriya Sharma from Health Canada.
Bienvenue tout le monde. Aujourd'hui, nous allons obtenir des réponses à vos questions sur la COVID avec Dr. Tam et Dr. Nou de l'Agence de la santé publique du Canada, Dr. Adams de la Direction générale de la santé des Premières Nations et des Inuits des Services aux Autochtones du Canada et Dr. Sharma de Santé Canada.
I'm Samantha Yavin, a science communicator better known as Science Sam. I am joining you virtually from Toronto, which has Indigenous roots, including the Anishinaabeg, Haudenosaunee, Métis, Wendat, and Mississaugas of the Credit. They and many other First Nations, Inuit, and Métis peoples have been calling this land home for a very long time. We'd love to hear where you're tuning in from too. Please share that in the comments with us. And don't forget, tag your friends and family so they can tune in with us as well. Now, I'm thrilled to be here with my fantastic co-host, Danielle.
Merci Sam. Je suis votre deuxième co-hôte, Danielle Nadin, stratège et communicatrice scientifique. Je vous rejoins de Montréal, des terres non cédées des Ganyene-Garaga. Nous tenons à remercier les Premières Nations qui ont fréquenté Montréal pendant des millénaires et qui vivent encore sur ces terres pour leur accueil. Je tiens aussi à mentionner que c'est à Montréal que fut signé le traité de la Grande Paix en 1701 entre l'autorité coloniale de l'époque et 39 nations autochtones. Laissez-nous un commentaire pour nous dire d'où vous nous rejoignez. Ce serait aussi le moment parfait pour taguer vos amis ou votre famille qui aimeraient en apprendre plus sur les vaccins contre la COVID. Dans la prochaine demi-heure, nous allons répondre à vos questions les plus urgentes à ce sujet.
Thanks for sharing your questions and telling us what you're most interested in hearing about. We are delighted to have received so many great questions. So we're going to focus on the most common questions that you've asked. If we don't get to your specific question, keep an eye on this Facebook event page as we'll be sharing more information there after the event. Before we get started, please join me in welcoming Kevin Chen from Facebook Canada. Kevin is joining us from Ottawa, which is the traditional unceded territory of the Algonquin and Anishinaabeg peoples, specifically the Algonquin of Pikwakanagan.
Thanks, Sam, et merci, Daniel. Bonjour tout le monde. Je suis Kevin Chen et je travaille chez Facebook Canada. Hi, everyone. I'm Kevin Chen and I work at Facebook Canada. We have an incredible conversation planned today. I mean, how often do you actually have the opportunity to hear directly and from Canada's top doctors as they answer your COVID vaccine questions? This is really exciting and really an honor for us to be helping to host this. Dr. Tam, Dr. New, Dr. Adams, and Dr. Sharma, thank you all so much for the opportunity to collaborate with you on this initiative. I also want to thank you for your public service to your country and to Canadians. And thank you to the thousands of Canadians tuning in today. Since COVID-19 was declared a pandemic last March, Facebook has connected over 2 billion people all around the world to COVID information from health authorities, including the Public Health Agency of Canada, through our COVID-19 Information Center. Now, as COVID-19 vaccines begin to roll out, we're using our platform to connect Canadians with accurate health information about these vaccines, just like we are today. This work is twofold. In addition to connecting you with information from health authorities, we're also removing harmful content that could put people at risk. Since the start of the pandemic last March, we have removed more than 16 million pieces of content from Facebook and Instagram globally for going against our policies on COVID-19 related misinformation. I know we're all eager to come back together safely. The more good information we share from health experts like these doctors here today, the more we'll all understand about the virus and COVID-19 vaccines. And hopefully, we'll be able to hug our loved ones again soon. Encore, merci tout le monde. Et avec un grand plaisir, je vous présente les Dr. Tam, Dr. New, Dr. Adams, et Dr. Sharma.
Thank you very much, Kevin, for that introduction. I'm really pleased to be joining everyone today from Ottawa, the unceded territory of the Algonquin and Anishinaabe people. And I want to welcome all of you on behalf of Dr. New, Dr. Sharma, Dr. Adams. It's really great to see so many people interested and tuning in, wanting to learn more about COVID-19 vaccines. We have come a really long way since the beginning of the pandemic, and where we've come to now is a really critical juncture. I think it's incredible to think that it's only been within a single year time span after the new virus emerged, we have multiple safe and effective vaccines. And I'm really confident that these vaccines are one of the best tools to protect you and your loved ones from COVID-19. So as we move forward through the coming months, we must continue to work together. I'm sure many of you have heard me say time and time again, no one is protected until everyone is protected. And of course, that means washing your hands, physical distancing, wearing a mask that is well fitted, well worn, limiting non-essential travel, and following your local public health advice. And now it also means getting vaccinated. It means that doing what you can do to help others in your community as well. For example, I've heard of people who've been driving others to their vaccine appointments, helping your grandparents or your community elders book their appointment. It's really important for everyone to know the facts about COVID-19 vaccines. And so we're all really excited here to be here today to answer all of your questions. Over to Dr. New.
OK, thank you very much, Teresa. Et merci, Kevin, aussi de nous avoir présenté. Je suis content d'être ici aujourd'hui, aussi de faire le point. Je suis sur le territoire non cédé des peuples algonquins et Anishinaabe. Aussi, je vais vous accueillir au nom de Dr. Tam, Dr. Sharma et Dr. Adams et en mon nom. Il est bon de voir tant de gens en ligne et impatients d'en apprendre davantage sur les vaccins contre la COVID-19. Au cours de la dernière année, nous avons tous été touchés de façon fondamentale et nous avons accompli beaucoup depuis le début de la pandémie. Nous en sommes maintenant au point très important de cette lutte difficile. Il est incroyable de penser que seulement un an après l'émergence de ce nouveau virus, nous ayons quelques vaccins sûrs et efficaces. Les vaccins approuvés ici au Canada sont des meilleurs outils pour vous protéger et protéger vos personnes chères contre la COVID-19. Au cours des prochains mois, nous devons continuer de travailler ensemble. Nous sommes certains que bon nombre d'entre vous nous avez entendu dire « personne n'est protégé tant que tout le monde n'est pas protégé ». À date, cela signifie des bonnes pratiques individuelles comme par exemple se laver les mains, se tenir à distance des autres, porter un masque, mais aussi écouter et suivre les consignes des autorités de santé publique à l'échelle locale. Et maintenant, de se faire vacciner. Cela signifie également de faire ce que vous pouvez pour aider les autres dans votre collectivité. Et par exemple, conduire quelqu'un à ses rendez-vous ou aider vos grands-parents ou les aînés de votre collectivité à prendre leur rendez-vous. Il est important que chacun soit au courant des faits concernant les vaccins contre la COVID-19 et plus important, se sont à l'aise d'être bien informés afin de prendre une décision concernant la vaccination. Nous sommes tous contents d'être ici aujourd'hui pour répondre à vos questions. Merci.
We've heard fantastic questions from many of you to pose to the doctors today. And if you're just tuning in, we're going to focus on the most common questions that you asked. If we don't get to your specific question, remember, keep an eye on the Facebook event page as we'll be sharing more information there after the event. Dr. Tam, the first question is to you. We've seen a lot of headlines recently about shifts in recommendations. For example, this week, the National Advisory Committee for Immunizations recommended pausing administration of the AstraZeneca vaccine for those under the age of 55, whereas a few weeks ago, they were not recommending it for those over 65. Can you clarify for us how these decisions are made and why they changed?
I can see how it can be really challenging for everyone, especially if you're just reading shifting headlines. And it is important for us to sort of unpack some of the information. I think the fundamental challenge with this pandemic is that science and evidence and knowledge is always evolving and is emerging fast. So we have to act fast to adapt and evolve the guidance when new evidence warrants it. So in effect, for the vaccines, the changing evidence is warranted in order to optimize the safety and effectiveness of the vaccine. So it's about following the science. So in fact, what we're seeing really is the international and domestic networks for monitoring vaccine effectiveness and global vaccine safety system working in real time. So what actually happened was the National Advisory Committee examined, of course, the clinical trial information, where you have data from tens of thousands, say over 30,000 people, and demonstrated that the vaccines are safe and effective. But as more and more vaccines are rolled out in real life to tens of millions of people, more data is going to come in. So let's just unpack the data a little bit. So when the vaccines rolled out in real time, we got more information about the effectiveness of these vaccines in older age groups, particularly from the United Kingdom. And so therefore, the committee actually evolved its advice and said, look, the evidence looks really great. Initially, we didn't think we saw enough of the data, and now we're convinced. So hence the change in recommendation of these safe and effective vaccines for older age groups. Then the safety signal. So what we're seeing, as I said, is the global vaccine safety system working. Astute physician identifying a sort of clinical presentation after someone got vaccinated, which was unusual. It was serious. These are blood clots that are quite serious in terms of clinical impacts. And so what happened was, of course, the global network of regulators got together, scientists got together, and the National Advisory Committee on Immunization also, analyzed information in real time and determined that that there still needs to be more data gathered. And in the meantime, let's take the precautionary approach. How they looked at it was really the vaccine is safe and effective overall, but these rare and serious events were being reported in younger age groups. And for these younger age groups, the serious outcomes from COVID-19 is lower than for the older age groups. So hence, they went ahead and recommended that for now, put a pause for everyone's safety sake. Just put a pause for it until we get more data. So that's what actually happened. And I think it really is, I think Canadians should be reassured that the committee and our province and territories programs have their safety uppermost in mind.
Thank you, Dr. Tam. Dr. Sharma, anything to add?
Just to say that with respect to AstraZeneca on the Health Canada side, so there's two different parts of the decision making. One is the Health Canada side. That's to decide if a vaccine should be approved. We have the product monograph. And so from our perspective, we've been very consistent in terms of the use of AstraZeneca. So we've said we need to look at the data. And initially, the clinical trials didn't show that they had enough data in people that were 65 years of age and older. So we didn't authorize the vaccine. Then we did get information that showed that it was working very well in 65 years of age and older, including a large experience with people 80 years of age and older. So we didn't authorize the vaccine until we had that data. Then we continued that. So we actually haven't made any changes to the AstraZeneca product monograph, other than saying that there have been some reports of this very, very rare side effect, but overall the benefits still outweigh the risks of the use of the AstraZeneca vaccine in people from the age of 18 and up. Now, when NACI makes the recommendation, they're looking at it a bit more broadly. So they're looking at it from the perspective of whether or not you might have an alternative that's available, as Dr. Tam has said, on the epidemiology of COVID. So what we know about this side effect right now is that we're still looking at it. There's a lot of work that's being done. It's very, very, very rare. And there isn't a way to predict one group. There's no sort of risk factors of one group over the other that is more at risk. But we do know that it's something that you can detect, you can diagnose, and then you can treat it. So, what NACI has said is that let's put a pause on this for a short period of time while Health Canada continues to review that. That's one approach, and some countries have taken a similar approach. Other countries have also taken a very reasonable approach, which is that you keep using the vaccine for all age groups, but you make sure that there's informed consent and people know about them. those are both valid ways of approaching this, right? And as Dr. Tam said, this is really a sign that the system is working. You know, we have no cases of this rare side effect in Canada. We're working really closely with all of our international partners where they have seen cases, sharing information in real time. And if anything changes, of course, we'll change the recommendations and the advice to Canadians.
So much, Dr. Tam and Dr. Sharma, for answering that question. Donc maintenant, Dr. Nou, je vais passer à vous. Nos spectateurs, entre autres Cathy, Kim, Denise, Caroline et plusieurs autres, nous ont posé des questions sur la sécurité des vaccins contre la COVID. Est-ce que vous pouvez nous dire s'il existe des populations pour lesquelles les vaccins ne sont pas recommandés?
OK, bonjour et merci pour la question. Je pense que la réponse simple, c'est il n'y a pas des populations qu'on recommande pour ne pas se faire vacciner. C'est vraiment peut-être pour viser un peu sur les sous-populations. Si vraiment vous avez peut-être une histoire des allergies, c'est toujours une bonne idée de regarder peut-être s'il y a toujours une liste des ingrédients dans le vaccin et peut-être de discuter avec votre fournisseur de soins de santé si vous avez déjà une histoire de certaines allergies. Aussi, par contre, c'est aussi officiellement, on dit qu'on n'a pas assez de données probantes avec les essais cliniques pour faire une recommandation peut-être pour quelques groupes comme les femmes enceintes. Mais je pense que si on regarde vraiment les bénéfices et les avantages comparés aux risques, je pense que c'est aussi une bonne idée de discuter avec le fournisseur de soins en santé personnellement. Mais je pense en général, moi, je recommande en général, c'est une bonne idée pour tout le monde d'avoir une bonne conversation et afin de prendre une décision.
Merci beaucoup, Dr. Nou, pour cette réponse.
Dr. Sharma, right now the Pfizer vaccine is authorized for those over 16 and the others for those over 18. Do you know when kids and teens younger than this will be able to get a vaccine?
Thanks, Sam. And we do get this question a lot. So the reason that the different vaccines are indicated for different populations, so 18 and over for most and 16 and over for Pfizer, is because that's the population that was studied in the clinical trials. And we know that all of the vaccines that are authorized are also doing trials in younger individuals as well. And that's very common. So that's what usually happens with medications and vaccines. The clinical trials are done in adults, and then they do them in children. And children aren't just little big people. They are in different groups, and they handle and they metabolize and they respond to medications and vaccines in different ways. So we have to do the trials in different age groups. But because the trials have been done in adults first, those other trials in children can actually be smaller. And then we use what's called bridging data to then make sure that those vaccines are safe, effective, and of course of high quality and can be used in children. So with Pfizer specifically, just today, they announced results of their trials in ages 12 to 15. And we haven't seen the data yet. We'll be getting that in a couple of weeks at Health Canada for review. But in those trials, it's shown to be 100% effective in preventing COVID-19 infection. So there were no cases in the people, in the kids that were vaccinated. They've also started a trial in even younger age groups. So that's in age 6 to 12. But that will be some months before we get those results. So that's Pfizer. But with Moderna and with the AstraZeneca vaccine, as well as the Johnson & Johnson vaccine, they're also all doing trials in children. So it's likely that Pfizer, if all the data is fine, may be the first one where we'll be able to administer those to children at a younger age. But as we said, with any of these changes in terms of how the vaccines are used, the companies have to come into Health Canada, give us the data, we review it to make sure that the vaccines are safe and effective and of high quality, and that the benefits outweigh the risks in whatever population that it's studied in.
Thank you so much, Dr. Sharma. That's really good news. Now I'm going to move over to you, Dr. Adams. So many Indigenous people may have already received their vaccinations. And I know you've probably heard this one before, but why were Indigenous communities selected to be among the first groups to receive the vaccine?
Thank you for the question, and hello from Musqueam, Tsleil-Waututh, and Squamish Territories, now the city of Vancouver. And yes, this is a very common question. The National Advisory Committee on Vaccination named a number of priority groups for vaccination against COVID-19, including residents and staff of congregate living settings, people who are of older age when it comes to COVID outcomes, and for Indigenous communities where infection can have disproportionate consequences. Indigenous people still have the worst health of any ethnic group in the country, and they carry a disproportionate burden of chronic diseases. They have lower life expectancy. And because of where they live, often in remote and rural locations, services can be troublesome, should they get an infection. That and the social determinants of health, or the social determinants of Indigenous health, those of you who are in public health, there are other things related to health and well-being, like overcrowding or lack of access to clean water that can directly affect your health outcomes because it affects your ability to self-isolate or to keep clean surfaces and the like. So it was very early on that Canada identified protection of Indigenous populations as a priority. And I just want to say that there were, as I said at the very, very beginning, a number of places, a number of priority populations where we knew there was risk, and we started in many different places to start to vaccinate Canadians. And I last of all, I just want to say we're all in this together, and I hope that we're thankful and happy that so many fellow Canadians in many different fronts are getting vaccinated. Thanks very much.
Dr. Adams, it's such an important reminder that we are all in this together. Donc, maintenant, Dr. Nou, nous avons plusieurs questions, y compris une question de Damien sur si les vaccins approuvés au Canada protègent contre les variants préoccupants. Est-ce que vous pouvez nous donner une mise à jour sur les variants les plus répandus au Canada et comment les vaccins approuvés fonctionnent pour nous protéger contre eux?
OK, merci pour la question. Si on commence avec les variants préoccupants, oui, c'est quelque chose qui est inquiétant, qu'est-ce qui se passe à l'heure actuelle au Canada. On a de plus en plus des cas avec des variants préoccupants. Je pense que date, j'ai même des chiffres avec moi maintenant. Je vois que jusqu'à hier, il y a plus de 9000 cas de variants préoccupants signalés à ce jour hier au Canada, avec le variant B117 représentant plus de 90% des cas. Et aussi, si on regarde les trois variants préoccupants les plus importants, il y a plus de 8000 cas de variant B117, plus que 350 cas de variant P1 et 270 cas de variant B1351. Ce que je comprends maintenant, c'est avec les données probantes, en général, les vaccins sont efficaces contre même les variants, mais c'est sûr, les variants peuvent avoir un impact un peu négatif sur l'efficacité des vaccins. C'est quelque chose qu'on suit étroitement à l'échelle mondiale, mais aussi ici au Canada. Et c'est sûr que même les fabricants, les entreprises continuent à surveiller. Et si c'est nécessaire, c'est toujours possible de peut-être modifier au futur les vaccins contre les variants. Mais pour l'instant, je peux vous dire que c'est très important de se faire vacciner parce que de recevoir un vaccin donne un certain niveau de protection et c'est mieux de comparer de ne pas avoir un vaccin du tout. Donc, je pense que c'est quelque chose à suivre, mais pour l'instant, je peux vous dire que les vaccins sont efficaces en général contre les variants. Merci.
Thank you, Dr. New. Dr. Sharma, Health Canada has authorized vaccines from Pfizer, Moderna, Janssen, and AstraZeneca or Covishield for use in Canada. Lots of people are looking at the efficacy percentages. Those are from the clinical trials. And then the newer effectiveness results, which come from vaccinations outside of trials around the world. And they're wondering which vaccine is best. How would you compare the different vaccines?
Well, first of all, I'm happy that people are reading this information and are looking at it and are talking about efficacy and effectiveness. Obviously, that applies to the vaccines, but people may not necessarily think about it, but it applies to all the medications that we might take, all the vaccines that we might take. So part of it is this, new and very, very timely interest in these products and how they work. So I think that's a good thing, because I think people then have more information and they're empowered to learn more about the medications and the vaccines that they might take. The second part of it is that it's really difficult to compare vaccines because they weren't studied in what we call head-to-head trials. So in one trial, at the same time, designed the same way, you compare one vaccine to another. And what we know is that some of those trials were done last summer, for example, when we weren't dealing with the variants. They have different designs. So it is difficult to kind of compare. Where we can kind of compare, and where I think is most important, is that we know that all of the vaccines that have been authorized are equally as good in those things that matter the most. And those are the parts of COVID-19 that threaten us the most: severe illness, hospitalizations, getting so sick that you have to go to hospital because you have COVID-19, or in the most extreme of cases, dying from 19. So all of the vaccines that we have are all excellent, like 100% excellent in terms of avoiding being hospitalized because of COVID-19 or dying because you have COVID-19. So then when we look at the other, the efficacy and the effectiveness estimates that you've quoted, that's when it gets into the difficulty kind of comparing them, because as we said, the studies are a bit different, they're designed a bit different, they were done in different times. And what we're also finding is that when these vaccines are used in the real world, they're actually showing even sometimes better effectiveness than they were in the clinical trials. So even when we look at the efficacy or the effectiveness against preventing any kind of COVID-19 infection with symptoms, they're all actually very close to each other. So, I think what we've always said is that the best vaccine for you is the first one that's offered to you. And because, as soon as you take it, again, it helps you start being protected against those parts of COVID-19 that really worry us and concern us the most.
Thank you, Dr. Sharma. Dr. Tam, following up on that, the most popular topic in our poll on the Facebook event page for this live stream was about life after vaccinations. For example, Florence and Bronwyn, our viewers, were wondering, what if someone is fully vaccinated with 2 doses, but they get exposed to COVID? We know the vaccines are awesome at reducing their risk of getting symptoms and getting severely sick themselves, but can a fully vaccinated person be a carrier and transmit COVID to unvaccinated people, say in their household?
That's an excellent question. And as you said, we have seen how awesome these vaccines are in preventing individuals from getting sick, and particularly serious illness and death. And I just have to add to what Dr. Sharma said, some of the real life experience in Canada right now shows that the incidence of the cases are dropping in the over 80 years old, and we're seeing less outbreaks in long-term care facilities, which does give us some idea about not just individual protection, but maybe some clues about whether people can transmit. This science is evolving, but there are some very positive early indications that the risk of onward transmission, of you transmitting the virus, if you got infected after vaccination, certainly seems to be reduced. So that science is still evolving, and there's some news even today or yesterday, I can't remember. But first of all, there's very little study on actual transmission risk. There was a household study, for example, that showed the risk of transmitting infection to your susceptible household members would reduce by 30%. So that's just one study. Every study is done in different communities with slightly different environments, but that's already a good clue. And then the CDC just issued some results that were very promising very recently, which show that vaccinations and in their case, it was with the mRNA vaccines, reduces both symptomatic and asymptomatic infection, reduces infection. So if you didn't have symptoms, the vaccine seems to prevent asymptomatic infection, which is a clue that probably means that the vaccines can reduce transmission. And there are other clues. So if you swab people's noses after vaccination, there's evidence that there's lower viral load, lower viruses, and shorter duration of shedding of those viruses. And so I think all of those things look incredibly promising. And what that tells me is that we would expect the total number of infections to significantly decrease as vaccine coverage increases in the community. Not only just direct protection for each other, it's important that everybody gets the vaccine to protect each other. I protect you, you protect me, because vaccine isn't 100% effective, and you may be the one that can't get a vaccine. There's many people in society who might not be able to get the vaccine because of an underlying immune suppression or other effects. You might be the one for whom the vaccine didn't really quite take in terms of effectiveness. So you are dependent on each other to get protected. So these are great results that we will be looking at very carefully in terms of informing our guidance. But for now, obviously, follow those public health practices. Give us the room, the pathway for the vaccines to accelerate. So that's really important. But these are great, very recent results.
Thank you, Dr. Tim. So good to hear that optimism. So many of our viewers, like Sharon, and you know what, me as well, we're wondering if you can give us a sense of when we might be able to get back to things we miss. And as our last question, I also want to ask Dr. Tam, why are you getting vaccinated?
So that's two questions.
Yeah, just threw two in, you know.
Yeah, two for one. So when can we get back to normal? You know, right now, I think as people have heard me say, we're in a third resurgence in Canada with cases increasing. Not only that, there's been increased hospitalizations and some of the ICUs are getting full again. Now is not the moment to have mass gatherings and do whatever we want. Need to follow public health advice. We need to give it our best effort right now because the vaccines need time to take hold. There's many people who are not vaccinated right now in Canada. So I would see this period as one of the most challenging periods. It is the period of fighting the virus. This resurgence may not be the same as previous. We've now got variants who are more transmissible. So there's less room for errors, as many of my public health colleagues have said. Same measures, you just got to do them better. Give it one last really good go so that the vaccines, people can get vaccinated. Then I said recently, in actually during a modeling study session last week, to say summer brings hope. Because if you've seen the projections of the number of vaccines coming to Canada, we expect everyone who wants a vaccine to be to get one by probably around June or the end of June, that period of time. And that would protect everyone with that first dose and coming back then to vaccinate people with the second dose. So I expect that as the weather gets improved, people can go outside more, still maintaining good personal public health practices, that some of these activities that we love to do can resume more. But I'm looking forward to the fall, once everybody's had 2 doses of vaccine, and that we would pass what I call the crisis phase of the pandemic. You can ease these measures, begin to get back to some normalcy without this yo-yoing up and down of the virus surging. We need to clamp down, and then things get better, we relax, and the virus surges again. The vaccine is going to help dampen that effect, so that I hope by the fall we will not be in that sort of crisis response phase, and that people can go back to universities or schools in a safer way. And so that's what I think. And I think if everybody gives it their best try, both the public health measures right now, together with getting the vaccine, we're going to be in a lot better shape. Of course, this virus is very good at giving us surprises, so we'll be watching its evolution and the variants very carefully, but I definitely have hope.
Thank you so much, Dr. Tam, Dr. New, Dr. Adams, and Dr. Sharma for all of your work and for being with us here today. And thank you all for tuning in. We hope you feel empowered with accurate scientific information so you can be as excited for your vaccine as I am, because I want to get to that future you were talking about, Dr. Tam. I know
I didn't answer your last question, but it's okay.
Oh. Do you want to tell us quickly why you're excited to get vaccinated?
Well, you look really excited about getting vaccinated. We should ask you. No, I mean, obviously, I don't want to get sick and get hospitalized, you know, obviously, but it is absolutely about protecting others around me, my loved ones, my family, and others. And it is about a community protection effect. Mm-hmm. But mostly, you know, I like to get some downtime at some point. It's a bit selfish, but, you know, I just know that if everybody's protected by a vaccine, I'm going to get a little bit more rest, have a nap, maybe.
We're doing it for you then, Dr. Tam. Look, I know we couldn't get to all of your wonderful questions today, but we'll be sharing resources on this event page, and you can always find questions and answers on the Healthy Canadian social media pages, as well as the COVID-19 Information Center on Facebook. Please share this video, send it to your friends and family with concerns or questions about the vaccines. And remember, when you see information on COVID vaccines online from non-official resources, please pause and check before sharing it. I'm Samantha Yamin, also known as Science Sam. Thank you for tuning in, and I'll see you online.
Merci beaucoup, Dr. Tam, New, Adams et Sharma. Nous en avons énormément appris sur la COVID et les vaccins au Canada. J'espère que vous, notre public, vous quittez avec plus de confiance dans votre habilité de prendre des décisions informées par rapport au vaccin et que vous avez aussi hâte que moi à votre vaccin. Nous savons que nous n'avons pas eu le temps de répondre à toutes vos questions, mais on vous invite à continuer de les poser et on partagera des ressources sur la page de cet événement. Vous pouvez toujours trouver des questions et réponses sur les réseaux sociaux canadiens en santé, ainsi que sur le centre d'information sur le coronavirus de Facebook. Partagez cette vidéo, envoyez-la à vos amis, votre famille ou n'importe qui dans votre vie qui a des questions sur les vaccins. Et n'oubliez pas, lorsque vous voyez de l'information en ligne sur les vaccins qui vient d'une source non officielle, arrêtez et vérifiez avant de partager. Moi, c'est Danielle. Merci encore d'avoir passé votre temps avec nous et au revoir.